We're going to be demoing the lotions right now. You're going to find the difference between the lotions and creams to be more of a preference of what the therapist likes to feel. The lotions are going to absorb a little bit faster into the skin. This is one of the heavier lotions we're going to be working with called Therapeutic Touch, and it has a viscosity of 4. But it's still, if you want to use a lotion, it's going to be a good deep tissue lotion. So what I'm going to be demoing on the leg is just some different deep tissue strokes, talking about body mechanics again, and how you might want to incorporate this product into your modality. Okay, again, I don't take much and I want to rub it into my hands first. And then we're going to apply to the areas we want to work in. Doing some firmer strokes right now. Again, this isn't the lotion I would choose to do Swedish. This is still going to be a little bit more specific. Strokes are generally firmer and slower. And if you start to feel the glide not as much as you would like, you can apply more product. Just don't over apply, because again, it's going to compromise your body mechanics. So now that we've created a little bit of blood flow here, I step back so I can get my body leaning into the stroke. And then I'll move my body back instead of bending my arms. So now I know this force is coming right from the core. Most therapists have a problem with using their arms way too much to apply pressure in their strokes. You'll find that if you use too much product, you're going to end up having your wrist in a position that's not going to be advantageous for long-term work as a massage therapist. I do not want my wrist to go into this much extension. If I step back and bend my knees, I change the angle of my wrist. I'm letting it be the hinge joint that it is, then I lean forward into my stroke. Now, with not using too much product, I can lean forward, which gives me the traction that I want for the work that I'm doing, and biomechanically my wrist is being saved. You use too much product, you're going to have to be on top of your stroke, because you want still the stroke to go slow, but you've used too much so you can't lean in any longer. Okay, and watch the hands that you're using. When I'm doing anything medial, it's the inside hand. Going to work lateral on the leg, it's my outside hand. Better wrist alignment. Okay, and then I would reapply to go and work then down onto the calf, because I didn't put any lotion there when I started. My foot position, my body position is going to be different when I'm working on the lower leg. What was good for here is not good for here. My arms get too jammed up into my body. I need to step back so then I can get my body momentum moving forward again. You know, whether you're doing a deep effleurage stroke, petrissage, or muscle stripping, still want to step away from your strokes. And you can also be using your forearms. Again, that's all up to you, the techniques that you work with, and what your client wants to receive as well. Nice slow strokes. The slower you go, the more that you feel underneath your hands. And if you're going to do structural body work, and if you're looking for contracted tissue, go slow. You can feel those points and you hold them. Then release them nice and easy and move on. Then we're going to be moving on to the other leg. And we're going to be using the Swedish lotion. And again, I'll work the whole leg with the Swedish lotion. It's going to have a little bit more glide to it, so you'll have more consistency in the stroke, and you don't have to worry about the product absorbing too quickly into the tissue. But remember, still won't give you the same glide that we had previously with the creams. Okay, so the Swedish has a viscosity of 3. So it's a little bit thinner than the previous one that we used. And again, bend your knees. Get your body moving forward. I can feel the difference in this. So I highly recommend that anybody watching this DVD, if you're looking for new products, to experiment with them. Feel the difference. And choose according to what you want to practice. And if you practice many different modalities, you might want a few different creams or lotions or oils at your disposal. Again, these are not as firm. They're going to be a little bit more fluid in nature. And again, we generally want to start more proximal to the trunk. Strokes going toward the heart, and then coming distal, which means further away. In the next segment, we're going to be going on to gels, and then on to oils. Doing similar techniques,